My name is Bridget Ellis, and I did my internship at Milford Animal Hospital. We're going to quickly touch base on a few instruments used in animal dentistry. If we look on the table, we can see the instruments used for oral examination. These are used for extractions. And if we look here, we can see the burrs and the drill bits used for cutting into the bone and the periodontal ligament for extractions. And this is the surgical blade used to make the gingival flap. And this is the prophy paste used for polishing. If we look over here, this is where they do the dentals. This is the digital radiology machine, which is a fairly new system we just installed a few months ago. Below, we can see a feline and canine diagram of the anatomy. Over here is the radiology panel. And on the other side is where the X-ray would come out. Right next to the dental table, we have the ISO machine, which is used for anesthesia. Now we're going to be jumping into a dental debridement. During this dental debridement, the doctor decided to do an extraction on this canine due to the recessed gum line.
As solid as it can be, but the gum should be here.
Oh, okay.
But look at what I've got.
Yeah, recession.
But the tooth itself is fine. Yes. If you were gonna try and take this tooth, you would have a hell of a job.
Yeah.
Because the roots are.
After doing the dental debridement, they would continue treatment with polishing. After polishing, the doctor will come over and check for any pocketing by probing throughout the oral cavity. It is important to note that the technician does not probe the animal's teeth. They also do not make any decisions on whether extractions are necessary or not. Only the doctor decides if extractions need to be made.
Thank you.
A nerve block is being performed right now on the canine that was showed earlier with the recessed gum line. Right here, they're making a gingival flap, which is important when performing extractions. This extraction was considered the most difficult due to the fact that the canine is the longest root in all animals.
There it is. Holy crow.
This canine measured to be 2 inches long. This is another extraction performed on the same dog. And the reason for extraction was furcation involvement and horizontal bone loss. Bisecting the premolars and molars is a common step in the procedure when performing extractions. This step is taken in order to prevent roots from shattering. This molar measured out to be a little over an inch long. After performing extractions, it is important for the doctor to proceed with suturing the site where the tooth was removed. This is an important step in order to prevent bleeding and to encourage the healing process. Here's a picture before dental treatment. As we can see, there is heavy tartar buildup on the canine. After treatment, you can see a huge difference in regards to the tartar buildup and to the coloring of the gingival tissue.